Okay. We have examples here, painless childbirth. So, continuous frequency is used for painless childbirth on the point of UB32 on the back and on spleen 6 and 7 on the leg. Because the patient is very restless, it is difficult to fix needles and an electrical stimulator to one place. Okay, medyo. Therefore, the same points are generally used with a transcutaneous electrical nerve stimulation or what we call TENS machine. Okay? Sa phantom pain, the most dramatic effect of continuous frequency electrical stimulation for pain relief is in the treatment of phantom pain. Sakit yun. When patients feel pain in amputated or otherwise lost part of the body. Example, second toe, yung mga napuputulan, okay? In this case, 6 meridians in the arm or leg are interrupted and the energy does not flow through. The treatment is very simple, okay? So we'll tackle the treatment. So, remember, the energy flows according to the organ clock. In the leg, the energy flows from the stomach to the spleen, and from the urinary bladder to the kidney, and from the gallbladder meridian to the liver. Okay, tandaan po yun. Place a needle on the gallbladder meridian on the part above the stump, or this could be anywhere along the gallbladder meridian, and not necessarily on a point. So remember sa meridian, okay? Sa gallbladder meridian. And another on the liver meridian, sa meridian po, okay? Connect these 2 points with the same outlet on the electrostimulator and give a continuous frequency stimulation of 5 to 10 Hertz. Ideally, the patient should feel the movement of the needles on both the points. If this is on, then you must select the wire so that the needle on the gallbladder meridian is felt. Kailangan nararamdaman nung sa may meridian, okay? The same procedure is repeated between the stomach and the spleen meridians and the urinary bladder and kidney meridians. The needle should be stimulated for 30 minutes. The pain will reduce after this first session. However, treatment must be given twice weekly for a total of 8 times, okay? Let's go to intermittent frequency. This is a burst of electrical impulses that last for a few seconds, which after an interval of a few seconds is followed by the next burst. So ayan po yung drawing. It is generally used to tense and exercise the muscle in flaccid paralysis. Flaccid, okay? So we have here clinical example, facial paralysis or Bell's palsy sa patient, okay? Yung patient with flaccid paralysis of the facial muscles, acupuncture with intermittent frequency electrostimulation may be used on the following points to increase muscle tension and strength. So remember po, gallbladder 14 through to mid-eyebrow for raising the eyebrow, stomach 3 through LI20 for wrinkling the nose and lower eyelid, stomach 7 through to SI 18 and stomach 6 through to stomach 4 for smiling. These needles are connected to the electrical stimulator with intermittent frequency. When the current burst comes, the whole side of face will move for a few seconds and then relax. This will happen every few seconds. At the beginning of the treatment, the facial muscles are too weak to continue with this stimulation for 20 minutes and lose the stimulated movement within 5 minutes. This will improve in the subsequent treatment sessions and the length of stimulation can be increased gradually. Unti-unti pong dadagdagan. Okay? So, let's go to dense dispersed frequency. Ito yung drawing niya. These are 2 different frequencies that alternate with each other so that the patient does not get used to stimulation. It is used in pain relief therapy for longer periods such as acupuncture, analgesia, in childbirth or surgery. Usually, the patient gets used to the electrical stimulation within 20 minutes and feels it is necessary to increase the intensity. So, titingnan nyo kung kailangan dagdagan. This is not a problem in case of the dense dispersed frequency, and the needle stimulation will be felt and be effective as long as it is required, so that the sensation of pain will not return in the middle of an operation.